Of August 2023. My name is Fatia Mohammed. Today on the program we'll be discussing cholera in the country, the state of cholera, of course. In studio I'll be joined by, or rather I'm joined by Dr. Emmanuel Okunga. He's the head of disease surveillance. He'll be telling us about the cholera vaccine in the country. So far we do know at least 196 cases. Deaths have been reported across 26 counties. So we'll be having that conversation in just a bit, but first off, cholera oral vaccination campaign was launched in Nairobi County this week. The campaign is aimed at ending an ongoing cholera outbreak that first surfaced last October. As of 18th July 2023, 11,181 cases were reported and 196 deaths across 26 counties. Now, around 1,500,000 oral doses are scheduled to be administered. The focus will be on the 8 most affected counties. That is Homa Bay, Kajiado, East, Marsabit and Nairobi are among the affected ones.
The vaccine type is the same for all people across the age groups. So we'll have two vaccine brands. But whichever brand is used in a county will be used for everybody across board. So there are no differences in the vaccine types for different age groups.
We want to actually assure Kenyans that the vaccines that we are going to roll out are the most effective tool that we want to use to ensure that we push all these cholera cases to zero. In Machakos, however, we will concentrate on vaccinating the residents of the GK prison camp and the school for the deaf. While in Garissa, our focus will be on the new arrivals at the Dadaab refugee camp. The exercise will run for 10 days. That means the exercise will run up to the 12th of August 2023.
It doesn't mean that once you're vaccinated, you're now totally immune from getting an infection. With cholera, you still have to ensure that you're handling. And I think for most of us who are seated in this audience, we should always consider that we could still be at risk for getting cholera.
Right, let's just get into that conversation. Like I initially said, we have Dr. Emmanuel Okunga. He's the head of disease surveillance, Ministry of Health. Thank you so much for making time, sir.
Thank you very much, Fatia, and nice having me on your show.
Right, thank you. Let's just start off, of course, what is the state of cholera in the country? We've seen 11,181 cases have been reported and 196 deaths across 26 counties. What is the current state?
Yeah, so as you've indicated, at least 11,900. So since our last report, we've added to those numbers, so our current caseload is 11,935. And one more county has reported cases since the last report, which is Migori. So we now have 27 counties that have reported cholera cases since last year, October. However, in 24 of these counties, the outbreak has been controlled. So what we are now looking at is how to control the outbreaks in those 3 counties. In Nairobi and Mandera, the cases are fairly sporadic. Migori is a new outbreak, which we want to control as fast as possible. In terms of the vaccination, as you've indicated, we launched the vaccination campaign yesterday in 8 counties, Nairobi being one of them. In Nairobi, we are conducting the campaign in Kamukunji and Embakasi Central.
Right, before we get into vaccination, I wanted to talk about the basics when it comes to cholera. What are the symptoms of someone finding out that they do have cholera?
Yes, so a cardinal symptom. Most patients, by the way, with the cholera do not show symptoms. However, when they have moderate or severe symptoms, then they'll present with diarrhea, profuse diarrhea, which appears like rice water, and then you'll have vomiting. If not treated quickly, you can also end up dying.
Right.
Besides that, you could also have muscle cramps in the terminal stages of the disease. In terms of prevention, of course, the primary prevention measures are ensuring that stool does not get to the mouth. So you have to wash your hands well. You have to wash your foods well before you eat, if they are fruits, or you cook and eat hot food. And then you, of course, need to boil your water or treat it with water treatment chemicals.
Right.
And then, of course, you have to ensure routine hygiene measures every time before you take food, before you take water, and all the other issues.
How do you differentiate it with something like H. pylori? Of course, there have been cases of those kind of cases. You know, how would you differentiate the symptoms of the two with any related stomach issues? So
usually in cholera you do not have abdominal pain. H. pylori, you will have what we abdominal pain, usually in the upper abdomen, if it is associated with, say, peptic ulcer disease. But in cholera, we do not, usually we don't have abdominal pain. It's effortless diarrhea, and so it's very easy to distinguish those two conditions.
You've talked about another county being added, that is Migori County, in the cholera cases. What is leading to these outbreaks in these particular counties, especially also when we talk about urban centers like Nairobi, for instance? Is that there is contamination of water, or what is increasing the numbers as it is going up at the moment?
The biggest drivers we are seeing, of course, they vary from place to place, but the main contributors to these outbreaks, if it is the urban slums, we have challenges with access to clean, potable water. So people are relying on unsafe water sources, water bowsers that are not properly inspected. We also have contaminated food. There are a number of people that are growing food around sewage areas. All these are contributing. In rural areas, a lot of what is driving the outbreaks is open defecation. People not using latrines,
right,
and then the feces get to contaminate water sources. So those are the major drivers that we are seeing. But we're also seeing a new driver that is predominant is food vending. So food vending in congregate settings like weddings and other congregate settings is driving most of these outbreaks.
Right. So hygiene is a key factor.
Hygiene is the primary
factor
that we actually need to talk about, even before we talk about vaccination. Vaccination is just an added intervention.
But I want us to talk about the vaccination now. Of course, there's been conversation that the oral cholera vaccine that, was launched, some people do think it's actually new. So is it new? Has it been there? And what's the process like? Is it for how many months can you take the vaccine, or how does it work?
Yes, so the oral cholera vaccination has been around for many years, and it has been used in many other countries for quite some time now, more than 10 years. In Kenya, it's been available in the private sector. But in the government sector, this is the first year we are using it, mainly for outbreak response. So the first phase we used was in February, when we targeted 4 counties. Then this ongoing one will be the second phase. Right. So the vaccine is not new. It's been there, it's safe, it's tested, and it's WHO approved and has been used in many countries. Yes.
Have you raised any awareness when it comes to this vaccine? Do people know about it now that you've said it was in the, or rather it is in the private sector? You're just trying to bring it to the public. Are you raising awareness of it?
Yes, exactly. So we have our teams out there across all the counties that are vaccinating, that are delivering messages about the vaccination campaign in all the aspects. So from the vaccine safety, the quality, how we'll deliver it, where people expect to get it. We're also airing messages on media. We have media messages going on,
Right.
Social media, and many other mechanisms we are using to reach the communities, including religious leaders. Just yesterday, but one, we had a media breakfast where we had to educate the public on what we are doing and what they should expect.
You know, for a very long time, especially in the Africa setting, there's always a stigma when it comes to vaccination. Have you received such feedback? And even when you talk to religious leaders, how do they take that information?
So I think we can speak from the experience of our first phase of vaccination. So in the first phase of vaccination, we targeted to vaccinate about 2.2 million Kenyans above 1 year in the 8 counties. At the end of the campaign, we reached 99.2% of those people we targeted.
Right.
Which shows that there was high acceptance of the vaccine in the target areas. Our religious leaders, the community has been very supportive, and we see that as a result of that campaign, together with the other water and sanitation and hygiene interventions, we actually were able to control what would otherwise have been large outbreaks in those counties. So I think we are not very worried about the acceptability of the vaccine.
Right, sounds very positive. Now I want us to talk about the technical bit, especially with the National Multisectoral Cholera Elimination Plan 2022-2030. Tell us more about that.
Yes, so the National Multi-Sectoral Cholera Elimination Plan is a successor to our previous multi-sectoral plan, which ran up to 2018. Now, what the current elimination plan aims to do, first in terms of the overall goal, is that by 2030, we should have reduced the burden of cholera by 90%.
Right.
And we should not be seeing any cholera deaths in the country. So that, to achieve that, you need many actors, not just the health sector. So you need actors from the water sector, actors from the environmental sector, security sector. So it's a whole of government approach towards elimination. The other feature of the current elimination plan is we have done what we call hotspot mapping to identify areas at highest risk of cholera outbreaks. This will allow us to target our resources more efficiently so that we do not disperse our attention. We're able to focus on these high-risk areas and progressively to the least affected areas. Finally, the other component in this elimination plan is the introduction of oral cholera vaccination as an added intervention to the WASH interventions. Those are the key differences with the last. And then, of course, the other issue is we are anchoring to be able to coordinate all these various ministries. We are anchoring the plan at the highest level of government, we hope that the plan will be anchored at the office of the president eventually.
What are some of the challenges that you're facing when it comes to just making sure these policies are implemented?
Yes, so for now, I think implementation is not a very big challenge, but one of the key issues that always affects plan implementation is resources. So you need quite some resources to be able to deliver some of these interventions, because the water and sanitation interventions required demand a lot of resources in terms of putting up boreholes, water reticulation systems, sanitation systems. All those issues are quite resource intensive. The other issue, of course, is really, which is not entirely a challenge, it's something we are dealing with. We are working with communities, empowering communities, so that they're able to own these elimination interventions. So we think that we do not have very serious challenges in terms of elimination of the plan, apart from the resource aspect. We have a number of, we have staff out there, we have community health workers. So long as we have the resources to deploy them to the field, we have the resources to put in the infrastructure,
right,
then we think we can implement the plan. We are confident about that.
Very interesting. I'm now joined also by Lillian Mutua. She is the head of Health Promotion, Nairobi City County. Thank you for making your time here.
Thank you.
We were really just discussing about the new vaccination, or rather the vaccination that has been in the private sector and now is being introduced the second time to the public sector. What are your thoughts on the oral cholera vaccines?
I think this is the second time we are deploying it in Nairobi County, and we are very encouraged because during the February campaign, a lot of people came in to get the vaccine, and we were even overwhelmed by the numbers. And even after the campaign period, more are still asking, especially the people in the hospitality industry and the food handlers, and even the people working in the industries. So it is a good move that the government has made, though we are still educating people to know that they really need to take charge of sanitation and hygiene practices, because even if they take this vaccine, it can only prevent you for a while. Right. And you also need to adhere to the sanitation and hygiene practices. The other issue we have seen is that most people think that cholera is embedded into health. It's only the repercussions that now come to health. Once somebody is sick, they have to be treated. They seek for medical attention, and then the burden, the burden now comes to health. So we need to look at our sanitation practices, the way we are handling our food, the way we prepare, the way we store, and even where we are buying it from. We also need to look at our sewer connectivity. We need to look at whether we are having safe water for use, both at the household level, at the social amenities in institution. So it's really a collaborative effort. For the vaccination, like Dr. just said, we are telling people that the vaccination is ongoing. Using different interventions, we've gone to social media. Right. We are there in media. We are doing stakeholders meeting. And we even have teams in the ground who are purely just sending out this word. So in each and every sub-county that this is happening, we are having people who are mobilizing the communities to get the vaccine.
You've really summed it up, but I want us to talk about, there were some cases reported, around 4 cases reported in Kibra when it comes to cholera. Was it because of contaminated water also in that particular area? Was it also a sanitation issue because of that particular report that was reported in Kibra?
So not only in Kibra, but we have done water analysis, the water from the tap, and we find that it is not containing the Vibrio cholerae. So it really clearly tells us that not from the water system, but mainly from the way the people handle the water before taking. That is at an individual level or household or institution. The other challenge we have is when it comes to the informal, there is a lot of illegal connections for the water system because people do not want to pay. So once they do the illegal water system connectivity, there could be seepage of other dirty environments into that water that now they use. Then when we talk about latrine coverage, we know in some places it's very low. In some of these informal settlements, within the places, the residences, like in the plots, you might find they don't have the toilets. The toilets are communal. And for you to go to that communal toilet, you need to pay. And we know the socio-economic burden for the Kenyans at this time. So you'll find if the household head has like 5 people in the household, and they need to pay 10 shillings to visit the toilet at one go, then it's a very high burden to them. So we are also partnering with sanitation partners where they are showing people even ways of coming up with new structures within the communities, just to leverage on good practices for maybe to avoid open defecation and also to have proper sanitation practices.
Yeah, because that was my next question. You know, what are you doing, you know, from the Nairobi County, of course, to make sure that people, especially the illegal water connection is not being done, to make sure that the structures are built? So you've only talked about building partnerships and making sure that happens. Is there another way that you're trying to make sure that people stay away from that?
We've also introduced what we call the urban total lead sanitation within communities, where we talk to the communities and they take responsibility of seeing that they adhere to the regulations of good hygiene and good sanitation. The only challenge is, like we all know, the informal settlements are also illegal. And they don't have good sewer systems within. You'll find that these are the shanties that are built and demolished by still the people who own them at any one time. And because of having poor connectivity to the sewer, you find that at times they have overspillage. So we are really doing a lot of education, and people are understanding, because if we were not doing the education part of it and building the knowledge of people knowing the importance and benefits of good hygiene practices and good sanitation, then I think the cholera would not have been where we are today. We know each and every day we might get a case or two, but we have not had big cases in one place unless it's an institution, and you find there's also a different problem altogether. So this is being done, and we really appreciate the county government to enable different sectors work together to address this, because it's not squarely on health. Health will only give maybe the preventive promotive aspect of it and the curative. But when it comes to infrastructure, when it comes to housing, when it comes to the water and the sewer, it's also other departments. So there's very close collaboration with other line ministries, with line sectors in the county, and also the partnerships that we have built. So even for us right now, if we are responding to cholera, we are not only going as health alone. If we see there's a risk factor and there's maybe a spillage of a sewer or a burst sewer or even a broken clean water system, it's reported, and we have an emergency number for Nairobi County Health. They report to us. They can write on the social media pages and even give a photo shot, and we are able to easily interact within the sectors.
I want to bring in Dr. Emmanuel, since you're the head of disease surveillance. In Nairobi County, do you agree with her that's the situation that's there, and the challenge, the way they're dealing with the challenges, is the right way to go?
Yes, and you know, Nairobi County does not work independent of the national government. We actually work collaboratively. So the situation, as Lillian properly elucidates it. We have challenges with urban slums. And the urban slums, the challenges there are largely rotating around the housing and the infrastructure that goes with it in terms of sewers and in terms of water. So as we progress to make sure that we have proper housing in some of these areas, we have to have short-term measures and also medium-term measures that we have to undertake, including community education, supplying water treatment chemicals, also issues around just helping the communities to take up simple technologies like for water treatment, and also waste disposal. How do you make it better? So that is the concept she's talking about, urban total lead sanitation.
Right.
So the challenges are solving those challenges is progressive, but there is a clear plan on how we are hoping to reach out to this. The other challenges, of course, around contamination of the Nairobi River.
Right.
And although so, this will be done collaboratively across government and both levels, national and county government.
Okay, I just want to get your final thoughts, but maybe let me start with you, Lillian. Since media is one of the platforms for creating awareness, for someone who's watching, I mean, what would you tell them to just be aware of cholera and what to take care of?
Cholera mainly is about hygiene and sanitation. And the very candid steps of avoiding this, first is making sure that we embrace hand hygiene. Wash your hands before you eat anything, before you prepare any food, after and before you change the baby's diapers. Let us make sure we also wash our hands after we visit the latrines or the toilets. We also make sure that the food that we are taking is prepared under very hygienic places. We also make sure that if it is food that is eaten raw, it is well washed and also stored properly. If it is food that is cooked, let us eat it hot. If it is food that you've stored for maybe eating later, you also make sure it is hot. When you're having such outbreaks like cholera, we really don't advocate for people eating food that is not hot.
Right.
Because once it is boiled and you eat it hot, then it means it is safe for you for using. We also are discouraging roadside eating, which is very popular in this city, because around where this food is prepared and even served, the hygiene is not very good. And we are also engaging other people like the Ministry of Education through the schools. We have taught the children who are in school, the school-going children, we have taught them about cholera prevention. And if you rightly look at our statistics in Nairobi and even in other counties, you find the prevalence of children who have gotten cholera is also low, because children grasp these aspects very easily and they run with them. And we also are giving them this information for them also to be change agents at their household. We also are working closely with the religious leaders, with the hospitality. So what I'd really say is that for us to stop cholera, not only in Nairobi but nationally, we need to adhere to good hygiene and safe sanitation and hygiene practices. That is the only way that we can put a stop to this. Because you cannot go and guard or police people to wash hands, to boil water, to eat safe food. So it is a collaborative effort, and mostly the biggest part will be at community and individual level.
Right, very well put. What about you, Dr. Emmanuel? Your final thoughts?
Yeah, so cholera is an old disease. It can quickly kill you, but the prevention and even management is very cost effective. It can be done very easily. So ours mainly is to put in place systems that will control cholera quickly and efficiently. But more importantly also, as we control cholera, we're also controlling other diarrheal diseases,
Right.
like typhoid, dysentery, all this. And how we are doing that is strengthening our surveillance systems to detect possible cases of cholera outbreaks and other diarrhea outbreaks on time. We've strengthened our laboratory capacities across the country. We have trained our community health workers to be able to detect some of these cases and report to the system quickly, and also refer the cases to hospitals in time after giving them ORS.
Right.
We're also working with the other sectors because the Ministry of Water is a key player in the cholera elimination plan. So there is synergy between the Ministry of Water and the water sector actions in terms of the infrastructure development. And then the bigger issue is empowering communities to take charge of these actions. So we are engaging with communities through their key resource persons across the country. We have, besides the urban sanitation program, in the rural areas we have what is called community-led total sanitation strategy, which also empowers communities to look at their water and sanitation issues. So overall, this requires a whole of government approach, but also a whole of society approach to be able to control cholera and all the other public health emergencies that we confront on a day-to-day basis.
Yes, it's a collective measure. That's what you're saying. Thank you so much. That is Dr. Emmanuel Okunga. He's the head of Disease Surveillance Ministry of Health. And we also had Lillian Mutua. She's the head of Health Promotion in Nairobi County. Thank you for